So what about this octomom in California? If the American Society for Reproductive Medicine is a group of reproductive specialists that have come up with a consensus statement about how many embryos do we put back in a woman when she does in vitro fertilization. So, her eggs are removed, the eggs are fertilized outside the body. Now we have a group of embryos. Sometimes you have one embryo, sometimes you have 20 embryos. In her case, she had a lot of extra embryos. And her doctor decided to put back 6 embryos. 2 of those embryos split in half and formed 2 sets of identical twins, and the other 4 went on to be 4 individual babies. That procedure that doctor performed was really outside the guidelines of what the ASRM consensus committee agreed upon. That is 2 embryos in your 20s, 3 in your 30s, and 4 in your 40s. I believe she was in her mid-30s. She should have had no more than 3 embryos placed back into the uterus. This is not a law, it's just an opinion. So this group of fertility specialists, based on multiple pregnancy rates, will increase as you increase the number of embryos being replaced in the uterus. Because that is a real occurrence, we want to minimize that risk to individuals, the risk of having multiples. Having multiples can be dangerous. You could deliver triplets at 6 months and have a disaster, have a child with cerebral palsy. You can get lucky and have all 3 triplets, at 7, 8, 9 months, but they usually deliver early. So one of our responsibilities as an infertility specialist is to avoid someone having multiples. In our field, it's hard to avoid it sometimes, but one way we can avoid it is to have more control over the number of embryos we place into the uterus when a patient does IVF, or the other way, when a patient doesn't do IVF. For example, she's doing just fertility drugs that she injects, and she's about to release 10 eggs, and then she has intercourse with her husband that day. She's at risk right there. Maybe that patient should have been converted to an in vitro fertilization cycle where her eggs are removed, they're fertilized outside the body, and then she chooses only to put 2 of those embryos back instead of doing this with less control. So I really believe that doctor may be seeing some disciplinary action against him. It's not good for our field. It scares people, and the public really needs to know that this is not commonly done. I'm sure there are doctors out there in the world that are putting back more embryos than is recommended. There's always a certain situation where maybe you put back an extra one, maybe that embryo wasn't so good, maybe it didn't look good under the microscope, and the embryologist and the doctor decided together that we're going to add an extra one since it had a very low potential to begin with, and instead of freezing that embryo, we'll just place it back into the uterus. But generally, we follow the guidelines. We try to keep people or patients out of harm's way, and most importantly, we don't want to help somebody achieve a pregnancy, but the child has a problem.